Welcome to Wellness Turn. How do you know if you have a eating disorder? Let's talk about that for a little bit. So some people don't even realize that they have an eating disorder, or sometimes people know, but they are not trusting their instinct. So here is a little bit of information to help you discover what could be happening to you. And so you can seek help, especially if you are trying to lose weight or if you've lost so much weight and you don't understand what's going on. These few slides will help you to indicate if you need help. So, how do you know if you have an eating disorder? First, think about how you eat. Do you make yourself sick after eating? Do you find yourself wanting to go and throw up or make yourself sick so just you could get rid of the food that you've eaten? If that's you, consider that a concern. And this is pretty much known for people who have conditions that are associated with eating disorder. But um, in this case, we are looking for a pattern. Any of these conditions are not normal. So you definitely need to talk to someone if you have such behaviors. But if you, the more of these conditions that I'm going to mention, or I should say behavior, not conditions, the more of these behaviors you have, the more likelihood it is that you could be having an eating disorder. So you will need help to be assessed if you have more of these topics that I'm talking about. So we started with if you make yourself sick after eating. The next one would be if you are worried that maybe you have lost control over how much you eat. All right. If you worry that you have lost control over how much you eat, that is also considered an eating disorder, regardless of your size. Okay, so food is meant for us to enjoy it. If you always worry, constantly worrying, I'm not talking about just saying, oh yeah, I ate too much today, I shouldn't be eating that. But we're talking about when this becomes a constant worry, especially when we've lost a lot of weight, when you have those constant worry of how maybe you don't have control over food, that is a concern. So again, the more the concerns you have based on what I'm sharing today, the likelihood that you will need to be assessed. Starting with at least two of these would be a concern. But again, the more you have, the more likelihood that you should get an assessment. So the next thing would be if you recently lost weight. So not only that you're concerned about how much you're eating, maybe you've lost control, you think you've lost control over what you're eating, but also the fact that you've lost so much weight in a very short period of time. So to give you an example, this could be something like 15 pounds in 3 months. If you're losing a lot of weight in such a short period of time, that could be a concern that maybe you have developed an eating disorder. So you need to talk to someone and get assessed, most likely a primary care doctor. Okay, do you think that you are fat, but others say you are too thin? Do you think you are fat when other people say that you are too thin? If that has come to be one of your concern, you need to be assessed. And the last one I'm going to end with is, do you say that food has dominated your life? Do you feel like everything you do evolves around food? You can't spend like maybe an hour without thinking about food, not let alone, even 30 minutes without thinking about food. If you find yourself having to be involved in a food conversation thoughts most of the time, then maybe you have an eating disorder. And so keep in mind that an eating disorder doesn't have to be that you are too skinny in terms of people who are anorexia or bulimia. A food disorder could also mean that you have gained a lot of weight, and the opposite of what I said earlier. You know, you know that you are gained weight, and people know that you've gained weight, and you can't stop thinking about food you are always eating. That is also eating disorder. So get checked, get assessed. Sometimes the reason why people have eating disorders, it could be simply because you are missing key minerals and vitamins to help you stay away from those cravings, so your body could feel satisfied and don't get to those unnecessary cravings. So first being assessed, then looking at what is missing in your body could be one of the solution. So get an assessment, talk to your doctor if these are your concerns. If you want to see how we work for our team, wellnessturn.com, you can, of course, chat with us, especially if you don't have any health issues. We would be happy to work with you on a plan to help you maintain good health, maintain your wellness, and improve your nutrition as well as fitness. Again, that will be at wellnessturn.com. We have a chat there. You can send us a message and we'll chat with you and assess your needs. So thank you for joining us today. You can always watch another video here, or if you are happening to be watching this already on our channel, on our website, thank you for being on our website, and we look forward to sharing more information with you. Leave a comment, subscribe, and like, so we can continue to bring you all the knowledge as is published, and you'll be the first one to know. So share if you like this video, especially if you know someone who may have questions about eating disorders, what they should look for, and when to seek help. All right. We are ending it right here. Thank you. Talk to you soon.